Hello, ladies and gentlemen. My name is Jose Miranda Nunez. I'm going to be presenting to you coronary artery disease. So, what is coronary artery disease? It's a type of heart disease that's very common, and it causes the most amount of deaths in the United States for all genders. Coronary artery disease develops because of atherosclerosis, which causes a buildup of plaque to occur in the walls of the coronary arteries. Plaque consists of fatty deposits and other substances. This buildup will cause the vessel to narrow over time and eventually closing it. Unfortunately, plaque buildup can rupture, and if it does, blood clots can form and quickly shut down perfusion to certain areas of the heart. So here's an image of an example of healthy tissue all the way to the left, all the way to advanced plaque all the way to the right. In between, you can kind of see the buildup of plaque in the middle of the wall, but at the very end, you can tell at the very peak of the vessel, there seems to be some rupture. Here's another image of all the way from the left side. You have healthy vessels with the lumens completely entire open, all the way to the right side where you have the lumen near closed or almost 100% closed. Towards here, you can tell over time you have macrophages and fatty deposit cells that are combining in order to control and maintain this ruptured plaque. You have collagen or fibrin-like substances that are also combining with these molecules, and they control the plaque. Over time, it can completely close the vessel entirely. So I'm going to present a case to you with an 85-year-old patient who presented themselves at Health Park Medical Center with chest pain and shortness of breath. He stated that he was watching TV when he noticed some pressure starting in his chest. Over time, pain started to develop. He stated that prior to coming, he tried to relieve the symptoms with aspirin and 3 doses of nitroglycerin with 5-minute increments. So here are some lab results of hemodynamics. The main thing we want to kind of focus on is you can tell that the heart rate is 77 beats per minute, blood pressure of 144/65, and a respiratory rate of 16. All the other values right now appear to be within normal range or a little bit higher or lower. The patient did have a few allergies, and the allergies were lisinopril, IVP contrast, and heparin. The medications that was given to the patient was, upon arrival, they were given sodium chloride 0.9% flush and heparin and nitro-drip via IV. Since the patient did have allergies to contrast dye, the patient was given Benadryl and Salmeterol prior to the use of diagnostic methods to assess the patient appropriately. So the history of illnesses. So you have a patient presenting themselves with bronchitis, lung, colon, prostate, and skin cancer, congestive heart failure, previous coronary artery disease, disease of the central nervous system, moderate kidney failure, thyroid disorder, essential hypertension, lipidemia, liver disease, osteoarthritis, pneumonia, rotor cuff syndrome, and sleep apnea. The patient did have several past medical histories. So he had colon surgery, prostate surgery, gastroenterology procedure known as a colon resection, CABG. So the patient did have previous open heart surgery procedures for 3 grafts to other native vessels, knee and hip replacements, chemotherapy, which is radiation, and he had a previous STEMI in 2016. So during the diagnosis assessments, when the patient arrived with chest pain, we primarily start with an EKG and blood results. For this patient, the EKG showed ST elevations in leads V1 through V4, but the patient appeared to be stable with minor pain. When the blood results came back, it showed elevation in troponins, so a cardiac catheterization was scheduled for the patient to find out what the underlying cause was. So during the cardiac catheterizations, we made angiograms of the native vessels and all bypass grafts that they had. A lesion or blockage that was approximately 95% occluded was found in the left internal mammary artery that was bypass grafted to the left anterior descending artery. Typically, when we have a questionable lesion that's found, we use an FFR system to test the level of perfusion to the region of the heart. But because the lesion was so tight, based on the images with multiple angles that we achieved, it was ideal to treat the narrowing. So differential diagnosis. So we do have multiple ways in order to assess the coronary artery disease. And typically, we can start off with the most basic, which is the electrocardiogram. And that checks the electrical impulses throughout the heart and seeing if anything's being affected in the heart arteries. Now, when you find a blockage whatsoever, you're having no blood being perfused to certain areas of the heart appropriately, and it does affect the electrical impulses throughout the heart. That electrical impulse will be resulted in the electrocardiogram. Now, an echocardiogram is typically used in order to assess the pumping function or all the chambers of the hearts, along with checking the valve and how they are doing, whether they're stenotic or regurgitant. The echocardiogram is also a great way to assess the muscles inside the heart, just to see if there's any inflammation or maybe even fluids in between the pericardial sac. Now we have a physical stress test and a nuclear stress test. Both are used in order to simulate physical activities in order to see what's going on with the arteries. Typically, during stressful events or physical events, the heart will constrict. And for physical stress tests, we'll typically use things like a treadmill or any other physical activities. And with a nuclear stress test, we'll end up using medications to mimic physical-like symptoms or physical activities. After that is done, we also use electrocardiograms or other tests like an echocardiogram to assess the patient and we see if there's any differences or changes in the results. Cardiac catheterization is typically used for diagnostic and treatment. During cardiac catheterizations, initially we're going to start using equipment such as catheters and guides in order to assess the native vessels of the coronary arteries. When we assess them, we use contrast dye, and that's going to allow us to gain some images with the angiogram. And if we do find any blockage whatsoever, we can proceed to percutaneous coronary intervention. Then we do have cardiac CT scans, which allows us to assess the mediastinum and primarily look into the heart and see if there's any sort of inflammation or abnormalities with the area. And finally, we have blood results. And with blood results, we have two main things that we want to look at. Of course, with the usual lab results, but CPK-MB and troponin, which are cardiac enzymes. Typically, what you'll end up returning first will be troponins, and that kind of tells us if there is any damage occurring to the heart. So the treatment that we decided to follow up with, since the lesion was approximately 95% occluded, we treat the lesion by placing a guide catheter in the ostium of the vessel, so the ostium of the left internal memory artery. Then we use coronary guide wires to get through the lesion. After that, we use balloons to try to open up the blockage. And when we open up the blockage, we want to push that plaque buildup against the wall. Once we have that, our goal would be to place a stent in between healthy tissue, preventing any plaque buildup being exposed to the lumen of the artery once more. After that, typically if a patient has not received aspirin already, we will give them aspirin and some sort of blood thinners like Plavix, Brilinta, or Effient. So from here now, we have a future plan of treatment for the patient. From here, we want the patient to try to change their diet. We want them to help their arteries or try to at least prevent any more blockages from occurring. We want to maintain blood pressure because say if there is a vulnerable plaque and you have very, very high blood pressure, that could be so much force enough to rupture another plaque buildup. Then we also want to lower the levels of cholesterol. The lower the cholesterol levels, the better it is because that's less plaque buildup and less chances of more lesions to occur. The patient is going to end up having to remain on blood thinners for approximately a year or until a cardiologist informs them that they can be done with the medication. Reason being is because we can cause in-stent thrombosis, meaning blood clots can form within the stent if medications are not maintained. We want the patient to maintain with physical activities, try to walk around, do anything they can to be physically active. That does help with overall body weight and changing the function of the body. Lastly, we want to change any lifestyle changes. So, for an example, if the person is a smoker or a drinker or does any kind of drugs or whatever it may be, it would be ideal for them to fall back from that. Or, like I said earlier before, changing their diet, a proper diet. Instead of going from your greasy foods or your really, really fattening foods, you want to go for something that's a little bit easier on the body. So, in conclusion, coronary artery disease is a very serious heart condition. We want to know when to seek medical attention. So at any moment in time you find any kind of chest pain that's abnormal and you have never felt it before, or you start having any kind of heart-related symptoms, don't hesitate to go to the hospital immediately because it is fatal. So going back into the patient review, so we didn't have that 85-year-old patient who knew that he was having a chest pain and he acted immediately. So the first thing he did was try to resolve the situation with some medications and it did not help. So he went and sought for medical attention, which is what he did. After he got the medical attention, he did do a little bit of assessment, and the diagnosis assessment included an EKG, and after an EKG did find some elevations in leads V1 through V4, which are typically your anterior leads, your left anterior descending artery. He got the treatment that he needed through a cardiac catheterization, and they pursued towards percutaneous coronary intervention. It is very crucial when it comes to coronary artery disease because at any moment in time you are blocking any kind of perfusion to the heart areas, and when that happens, dead tissue can occur, and time is muscle. So we want to rush as soon as possible to treat those kind of coronary artery disease if we find a blockage that is significant. So thank you for your time. I hope you guys enjoyed this presentation. Here are my references, and I hope you guys have a wonderful day.